Hello, dear doctors, and welcome to this small session today. This is Dr. Sahar Ali. I am working in the NHS in acute medicine unit. I am also a simulation faculty for the junior doctors in my trust. I am the founder of Plab2 Warriors groups. In these groups, I do provide Plab2 Warriors courses, Plab2 Warriors one-to-one mocks, and free mocks as well. And all of them, alhamdulillah, are rated as outstanding. In terms of the courses, I do have the full course and the practical course. In these courses, you'll find high fidelity simulated scenarios. All of the scenarios are done by me using the GMC Bell in 8 minutes, so you can feel the pressure of dealing with the patients in 8 minutes. Also, in the practical part, I use the SimMan with the monitor, so you can feel the pressure in dealing with acutely unwell patient. In addition to that, I use the mannequins to do the examinations on them, teaching scenarios, and in the course, I use my lovely mind maps. All of the doctors love them because they are very organized, systematic, and to the point. As you can see, each mind map for each case is divided into halves. Half for the data gathering and half for the management part. In each case, you will find what are the important points that you need to ask in the data gathering, in history, in examination, and in the investigations, and in terms of the diagnosis and management. In diagnosis, you can find an idea about how to deliver the diagnosis of this particular case to the patient in a simple way. Then the management of each case based on the NICE guidelines. Alright, this is my YouTube channel. You can just click on the playlists. You find two playlists for me, for my videos. The playlist of the marking criteria and playlist for the free mocks. Alright? If I would give you an advice today, it would be, please, dear doctors, do not lose hope and be optimistic. Always think positively. Alright? Let's start. In this video, I'm going to talk about 3 points which are extremely important to all of you. I will talk about how to prepare, the NHS system, and what is your job as an FY2 doctor. Let's first go with how to prepare. In this point, I'm going to talk about the average time to study, courses, academies, and notes, taking mocks, and how to practice. Please, if you don't mind, write down the points that I'm going to say to follow them as much as you can. Average time to study. Try to study as early as possible. 4 to 5 months is an ideal time. This to have time for revision. Revision is always important. When you study something at first, you get 50% of it. If you study it again, you get 70% of it. If you study it for the third time, you get 100% of the information. And this is a fact. So, revision is always important. Is it mandatory? The answer is no, but This average time is the standard for Plab2 preparation. I know that everyone is different, and some doctors gain everything very quickly, maybe just 3 weeks before their exam and they pass. But on the other hand, some doctors need more time to gain the skills. So we always talk about the rule, not the exception. You have to give yourself time to go to the exam with clear mind. In my course, there are 2 study plans, one for 2 months and one for 3 months, and I always prefer the 3 months one. I always advise the candidates to follow the 3 months one. Why? The 2 months one is very, very tight. I always advise the candidates to pick up the 3 months plan. So they study in the 3 months, they finish everything in 3 months, and they after that have 1 month more for revision and refurbish their technique. All right? So this is the ideal time. All right? Courses, academies, and notes. Regarding courses, subscribe to the most suitable course for you. Whatever your decision is, go with it. All of the mentors are very supportive. Every mentor has her or his own way of teaching which will attract a group of doctors. I personally found the way of 2 specific mentors attractive to me. It doesn't mean at all that this will be the same to everyone. Everyone is different. All right? Regarding the notes, the best thing is writing your own notes. If you don't manage to do that, it's not a big deal. Study from any notes which you are comfortable with. If you are going to study notes, please bear in mind that the notes are only to familiarize yourself by the possible concerns. The notes are having specific scripts. The history taking and the management are based on these specific scripts. You cannot apply the script to the cases in the exam. In the exam, they change the questions, the situations, the context. You have to have flexible mind when you deal with the cases in the exam, because it might be different from what you have studied in the notes. It will be different sometimes. All right? At the end of your preparation, you will find that it is not about reading notes. It's about practicing on improving your technique and your way. In another meaning, improving your communication skills. Lots of doctors who got 10s, 11s, and 12s didn't give the very right treatment. In some occasions, they forgot an important thing, but their way made them pass easily with high marks. If you are a beginner, study and practice at the same time. If you are a repeater with adequate knowledge, stop reading and please work on your defects in your technique. If you are a repeater who still doesn't have the adequate knowledge, keep studying with practicing. The best thing is studying and practicing at the same time, simultaneously. The study plans in my course are designed based on this, because as I mentioned, the best thing is practicing from the start. Many of you ask this question: should I take a course to pass? The answer is no, it is not mandatory. You can pass without any course. Everyone is different, and everyone has their own circumstances. The courses are only to guide you. They are not a magic wand that you can use to pass. No, The courses are a kind of aid for you. They guide you to the right way. If you already know the right way, so you can pass without any course, right? The main factor to pass this exam is you, your hard work, you're working on improving your technique and your understanding of the principles. All right? There is another question. Should I attend an academy? Well, this really depends on your preferences and personality. I have many people in the full and the practical courses who only relied on my course and they passed, alhamdulillah, without any additional courses or academies. They just practiced on pillows and dolls. Some of them scored 9 and 10 out of 12. Some others went to an academy for 3 or 4 days to do some hands-on practice. So this depends on the candidate's personality and what makes them feel comfortable. Some of the candidates panic when they see the sim man and the mannequins for the first time. And on the other hand, some of them manage to pass practical stations easily with proper practice at home. So it is entirely down to your preference. If you feel that you're going to be comfortable to go an academy and do some hands-on, all right, any academy that would enable you to achieve this should be fine. Regardless of what you decide, the aim is to repeat and rehearse the steps of examination and procedure. All right? Myself, I didn't manage to attend the academy except for 5 days. I was practicing on pillows and dolls at my home. If you cannot afford to go to the academy, this is not the end of the world. Use the pillow or the toys for the examination. For the procedure, you can buy the cannulation kit or the catheterization kit from any pharmacy or any medical equipment stores in your country, if this is allowed in your country. There is another solution which might work here in the UK. Almost every hospital has got skill lab or simulation room. It might be worth getting in touch with the medical and dental education department at nearby hospital. You can tell them that you are a Plab2 candidate and ask if they can accept external visitors who need access to the lab. Some hospitals may accept that for free or for small fees. Alright? Mocks. Take with whoever you're comfortable with. All of the mentors are working very hard and they are very helpful. But make sure that this mentor has experience in Plab2 field, not a one who just passed his exam or her exam. I highly advise you to take different mocks with different mentors to see different point of views. If you are going to attend an academy, take the mock of the academy to get used to the exam atmosphere. If you are not going to go to the academy, it's not a huge problem. Try to plan with your partner to practice the whole 16 stations back to back without any comments in between. You can do this. You can plan this together. All right? Practice. Write down, please. Watch the videos of Hippocratix. This is for you to see how they approach and interact with the patient. The link of these videos is in the description of this video. Choose the topic that you are going to study and study it. Watch its video from iMedics or Hippocratix. Simulations are always helpful. If you are going to subscribe in my course, there is a simulated scenario for each topic to give you an idea about how to deal in each topic. Find a group of studying 4 to 5 doctors. The purpose is to benefit from different comments from different people. If you want to continue with the group, it's okay. If you want to have more time for practice, pick up one partner who has nice interpersonal skills to go with him or with her through all of the approaches. All right? And please, please, doctors, simulate very well to each other. Switch the cameras on when it's face-to-face or video consultation. You have to train yourself on the exam condition. It's really important. Avoid practicing by systems. Practice by approaches. We have in Plab2 14 approaches in addition to the practical cases. The exam is approach based. That's why my course and the study plan are approach based as well. If you don't manage to practice by approaches, please near your exam, maybe 2 weeks before your exam, divide the approaches 7 in one day and another 7 in the next day. For every day up until your exam. You can find the general approaches PDF in the video description. Alright? When you practice, just take one case on each approach to practice on it. By practicing by approach, if you do this 2 weeks before your exam, you find yourself that you have practiced on all of the approaches every other day till your exam. So this will help you to master the technique and you will not struggle in the exam. We can talk in more details about practicing by approach in the next videos. Alright? During the practice, if you can please, try to plan with your partner for these points. Share the question to each other. You know that in each case, you have 1.5 minutes for preparation. Please, if you are going to simulate as a patient, share the stem to your partner who is going to take the doctor role so he or she can read the question and pick up the task and know what are they going to do. All right? It's very important. If you don't train yourself on that while you are practicing, you are not going to have this focused reading in your exam in the 1.5 minutes. All right? Change the concerns and findings to get used to practice in different situations. When you judge, use the 10 skills marking sheet, the qualitative mark sheet. In terms of time, don't overwhelm yourself by the 8 minutes at first. You will be faster by time, so don't worry about that. If you have 3 weeks before your exam, practice with as many people as possible. When you get used to a partner, change them to get used to different simulators. Why? In the exam, you are going to deal with 16 different simulators. So you have to train yourself on dealing with different people. You will know the time that you are ready by the fewer comments you get from the partners. My 3 golden tips. When you practice, record and listen to yourself. No one will judge you better than yourself. This is the best way ever. That's what I did before my exam. Yes, it took a long time for me to listen again to myself, but it made a big difference. It made me respond confidently to the simulators. I was practicing in the morning and then I listened to myself when I was doing my home duties, then I work on correcting them in the next day when I was practicing. The second tip is, before you practice with your partner on a topic, try to practice with yourself on this topic. How to do this? In each case of the wanted topic, try to memorize the most important question, in this case, in the history taking. And in the management, try to practice on how to give and deliver the diagnosis in a simple way and how to deliver the plan of the management. To clarify this, let me give you an example. As you can see, this is the history-based approach of eye system. We have here these cases: subconjunctival hemorrhage, conjunctivitis, cataract, retinopathies, and so on. When you study with yourself, pick up one by one. Let's take subconjunctival hemorrhage first. Try to memorize the most important questions that you cannot forget, in this case in the data gathering. Then, in the management part, try to imagine that you are talking to a patient. Like, okay, Mr. X, you've told me that you have this patch or this redness in your eye. When I examined you, I found a patch in the white of your eye. Alright? All of these are suggestive of what's called subconjunctival hemorrhage. Have you heard about this before? No, doctor. Okay. So we have a clear membrane covering the white of our eyes. When there is a small bleed underneath this covering or this membrane, this is called subconjunctival hemorrhage. Am I clear so far? Yes, doctor. Okay. So the good thing that it is a self-limited condition and it's totally harmless. The body will absorb it by time. It's like a bruise and it will go on its own. Would you like to know the management plan? Yes, doctor. Alright, so let's talk about what we can do for you and what you can do for yourself, and we will be happy to see you again. Which one would you like to talk about first? Whatever you want, doctor. Alright, let's start by what we can do for you. In terms of this, we will do some basic investigations like bleeding and clotting profile just to be in the safe side, and we will follow you up. Alright? In terms of what you can do, just keep an eye on yourself. If you feel like you have the symptoms are worsening, you have a problem in your vision, please do seek medical advice urgently. Alright? Do you have any concerns? Are you okay with that? Yes, doctor. And move on to conjunctivitis. And so on. This is how to study with yourself. Okay? Alright. The last tip, which is, do not ever, never let anybody affect your trust in yourself, your performance, or your confidence. And my advice to the doctors who give their feedback, please try to avoid the words which will affect your friend negatively. Critique is a skill that is different from criticism. So please make your feedback constructive. I have given to you the important tips. You can do them all. You can do some of them. You can adjust them based on your abilities and your circumstances. Alright? So this is regarding the practice. Now we will talk about the second point, which is the NHS system. You have to know that the NHS system is extremely complex, and I will give you the very basics which are important for the exam. This will allow you to know your position and what will you do. They have general practice, walk-in center, and hospitals. In the general practice, the patient may be treated directly there or may be referred to the hospital, either to the accident and emergency department or to the specialist clinics. In the walk-in center, If a patient didn't manage to book an appointment at the GP, or it is out of hours, I mean after 5 p.m., he will go to the walk-in center to be assessed there, and there he may be treated or referred to the hospital. All right? In the hospitals, they have the A&E, the specialist clinics, and the departments. If a patient is unstable, and this patient is in the A&E, in the emergency department, I mean, you should stabilize this patient first. Then you may send him home if everything is under control, or you may refer him to a specialist clinic, or you may admit him under the care of one of the departments. So you need to know where you are and what you will do. How to know this? How to know where you are? From the question. In the question, they will mention you are in blah blah blah. You are in the GP, you are in the hospital, you are in the walk-in center. Alright? Once you know where you are, and when after that you know that the patient is unstable, so based on this, you will manage the situation. If you are in the GP and the patient is unstable, you will refer him to the hospital right away. If you are in the GP and the patient is stable, you will treat him out as an outpatient and send him home. All right? And so on. Okay? The third point is, what is your job as an FY2 doctor? Definitely, you will take history, examine the patient, and you will order basic investigations. All right? This is the first thing. When you order the investigations, try to order the basic investigations first. And if the patient needs further investigation, you will refer the patient to the specialist to assess them and do these further investigations. All right? What are the basic investigations that you can do? Basic bloods, swabs, imaging like X-ray, ECG, and ultrasound. Okay? When you treat, you have to start by your job first. I mean, your job as an FY2 doctor is making sure that the patient is safe, the patient doesn't have any red flags or any emergency problem. If the patient is having emergency problem, you have to stabilize the patient first. Let's say that the patient is having low oxygen, so you need to give the patient oxygen. If the patient is having hypotension, you need to give him IV fluids. So you stabilize or you deal with the basics first, and then you can refer the patient to the specialist, or you can involve the specialist. Okay? When you talk about the management, you have to be organized. It's not proper to say the specialist role first before your role as an FY2 doctor. Alright? So always start by your role, and then you can talk about the other roles. You don't need to mention senior in every single case. If the case is okay and you can manage to deal with it without the senior, it's okay. You can add at the end of the station, I will check this plan with my senior and I will come back to you. But it is not appropriate to say, I will involve my senior to do these basic investigations. You have to order the basic investigations by yourself. You have to examine the patient by yourself first. So it is not appropriate to involve the senior from the start. The senior is when you get stuck. Alright? Alright, so this is regarding your job as an FY2 doctor. I shared a PDF about 7 mistakes in the preparation. It is in the video description. Please watch it. It is very helpful. For any query about the courses or the mocks, please join our Telegram group, you are more than welcome. Thank you so much, doctors, for listening. I hope that it was helpful and to the point and will help you in your preparation. Do your best and all the best. Bye bye.